in December 2010, starting with Ontario. And since then, 9 of 10 provinces in Canada have begun to adopt pharmacy technicians and recognize them as a regulated healthcare profession. The main rationale provided initially by the Ontario College of Pharmacists, which is the governing body for pharmacists and pharmacy technicians in Ontario, was to free up time for pharmacists to pursue their own expanded scope of practice activities. And I'll be talking a bit further on what exactly these scope of practice activities are, but in general, the scope for pharmacists have also been changing in Canada. Pharmacists are taking along a lot more clinical services, and to help accommodate that, pharmacy technicians have been stepping up as well and be taking on more expanded roles. And I'll probably start the talk by just kind of classifying what is the difference between an RPT and a pharmacy assistant, or also known as a pharmacy clerk here. So here's some general roles and responsibilities that, at least in Canadian pharmacies, you might find individuals in these two professions undertaking. I want to draw your attention to the left-hand side of the chart, the bottom 2 points. As you can see, this is where you have major differences between the two professions, and that's that pharmacy technicians can accept verbal prescriptions from doctors, as well as provide prescription transfers. And so in between this step, for example, if a doctor wants to call up a community pharmacy and prescribe a medication on the spot, previously a pharmacist would be the only individual who kind of accepts this prescription. Now pharmacy technicians can do this in these provinces. The other point I want to make is that pharmacy technicians in Canada can complete the technical check of both new and refilled prescriptions. And what does this mean by technical check? That means that pharmacy technicians are the ones who can be responsible for and be accountable for identifying that the right patient, the right drug, the right dose, and the right doctor is being dispensed to the patient. Where does the pharmacist kind of play in this kind of role? The pharmacist would be the person, they can also perform the technical check, but they are the only ones who can perform the clinical check, that is, determining the clinical appropriateness, the therapeutic appropriateness of the medication. So for example, if I were to take an antibiotic amoxicillin, the prescription is for 1 tablet of amoxicillin 3 times a day for 10 days. The pharmacy technician can intake this prescription, they can enter the system, they can fill the prescription, they can then confirm and identify that 30 capsules of amoxicillin have been put into the medication bottle. That's the right doctor, right patient, right drug, right dose administration. But it's the pharmacist that before the medication goes out, the pharmacist has to confirm that this amoxicillin is appropriate for the patient in that instance. Contrast this to the pharmacy assistant role, they cannot perform these last two functions. And that's where the biggest difference comes in when I'm talking about 2010 to post-2010. So pre-2010, you can kind of see how a lot more work was assigned to the pharmacist, and it took a lot more time for them. And because of that, it's a bit more difficult for the pharmacist to take on these expanded scope practice activities. From regulation perspective, I kind of alluded it to earlier, pharmacy assistants, they're not considered regulated healthcare personnel. No accredited program or registration with the provincial college is required. You can have a high school student go and claim that they're a pharmacy assistant. You can also have a person who's been working in a community pharmacy for 20 years, and they're also classified as pharmacy assistant. The only time that you can use the role of pharmacy technician, and this changed starting in 2010, is that you have to, 1, complete an accredited training or bridging program, and you also must pass the Pharmacy Examining Board of Canada. We call it the PVCs here. We call it the PVCs in Canada qualifying exam. Upon completion of an accredited program and passing this licensing exam, then these individuals are able to call themselves pharmacy technicians. They will then go on to register with the Provincial College of Pharmacists, and they're considered regulated healthcare professionals. So that is to say, this is a protected title. Individuals can't claim that they're a pharmacy technician unless they complete the requirements that are stated here on the left-hand side of the table. Prior to 2010, there were pharmacy technicians and there were pharmacy assistants in Canada, but in terms of who can claim these titles, who can use these titles, it was definitely less regulated. A high school student could have called themselves a pharmacy technician, and there's no way to really challenge that or protect that title. So a lot of work has been done to get to this stage where pharmacy technicians are finally, I think we're kind of catching up in terms of a Canada-US perspective, but this is a great kind of change that's happened in Canada, and since 2010, a lot of excitement has been generated on what this means for the profession and what we can do here moving forward. So why would a pharmacy owner at this point hire a technician? To kind of give some background into it, remember prior to 2010, what a pharmacy would look like is you maybe have one pharmacist and one pharmacy assistant. So imagine here in a pharmacy here in the United States, that's one pharmacist and one pharmacy clerk. There's no technician really involved at all. But with this regulation, there's many incentives from a business perspective for a pharmacy owner to start using technicians. First one I want to talk about is wages. Technician wages a bit less than that of a pharmacist. So one can imagine in a busy pharmacy, instead of hiring two pharmacists to perform all the different tasks that are needed, why not hire one pharmacist, one pharmacy assistant, and one pharmacy technician? Because of the expanded roles that a pharmacy technician can now take, you don't need to hire two pharmacists to do the same amount of work. And in addition to that, pharmacy technicians have specialization. They can focus on a few tasks and become very good at what they do. And in most instances, they are more productive than pharmacists in these tasks, such as verifying the technical appropriateness of the medication being dispensed. The last reason I want to talk about is kind of the motivation for provinces to regulate pharmacy technicians in the first place, which is to give pharmacists more flexibility in their tasks and schedules, pursuing what I've kind of alluded to, the expanded scope of practice. So what does the expanded scope of practice for pharmacists look like? So these are the kind of changes that pharmacists are now taking on. This is in the medication prescribing, especially for specific minor ailments, the ability to adapt or manage, aka renew prescriptions without having to talk to the doctor to do this. Pharmacists can now administer injections, they can order and interpret lab tests. Two changes I want to highlight, at least in Ontario, is the ability to perform something called the meds check, and as well as pharmaceutical opinion. So overall, pharmacists are kind of taking on these roles, doing more clinical services, and as a result, the pharmacy technicians have a unique perspective and role to play in here to help facilitate these changes. What are meds checks? Just alluded to the second last point of this slide earlier. It's a one-to-one consultation that a patient will have with a pharmacist. This is great in terms of the patient will book an appointment with their community pharmacist, come in, bring in maybe a list or maybe physically bring in all the medication bottles, all their prescriptions. They'll sit down in an office with the pharmacist, and over the period of maybe 15 to 30 minutes, they'll have this conversation where they can better understand their medication regimens. They can ask questions, why am I on this blood pressure medication? I don't know what atorvastatin is doing good for me. I don't really feel the effects of it, for example. It's a great opportunity for the pharmacist to sit down, clarify why the patient's taking these medications, address any medications that they should or should not be taking, make sure that they're taking the medication properly. It's really a great opportunity for a pharmacist to really establish further the relationship that they have with patients and reinforce good medication intake. There's many different types of meds checks that are done in Ontario. I won't really go into depth in terms of what the different types are, but the most common one is the meds check annual, and that's kind of what I described earlier, where the patient comes in, brings the medications, and through a 15 to 30-minute conversation, talk to the pharmacist on what medications they're taking and if that's going well for them, and also address any questions that they might have. And that kind of leads into the research that Paul and I wanted to do and the study that we recently published in the Canadian Pharmacist Journal. And that's looking at the uptake and regulation of regulated pharmacy technicians in Ontario community pharmacies. In particular, we took a look at the meds check that we described here. So the meds check being the example of that expanded scope of practice that pharmacists are taking on, has the advent and the implementation of pharmacy technicians had a positive impact on that. In addition to that research, we kind of wanted to give a general profile of what are the characteristics of pharmacy technicians working in Ontario and what kind of pharmacies are hiring technicians. It's been 8 years almost since pharmacy technicians have been licensed in Ontario, and to Paul and I's knowledge, based on our literature research, there's next to no literature published on how this uptake has been occurring in Ontario, and that's what we kind of wanted to analyze. For myself, working from a pharmacy background and pharmacist perspective, I've worked in the community pharmacy for 3 to 4 years now, both as an assistant and as a pharmacist, and pharmacy technicians play such a valuable and vital role in the community pharmacy setting. And I think Paul and I really wanted to kind of, put some research out there to kind of see what's the status of it so far and what we can do to make sure that that rollout is going smoothly and pharmacy technicians are really being used to their fullest potential here in Canada. And so based on that, I want to invite next Paul, who will kind of speak a bit on our research.
Testing. How is everyone doing today? Thank you so much for coming all the way across the country to hear me speak. I hope you're able to enjoy other things about this conference as well, like other events.
Yes.
Okay. Glasses. Getting to the age. Early 50s get to wear these now. All right. So thank you again. I'm going to talk a bit about the technical aspects of our study. Excuse me. What we did is we assembled a big database of community pharmacies in Ontario. The data came from two different sources. The first source, so for each pharmacy we had information from the Ontario College of Pharmacists, the OCP, the regulatory body. The names and some basic information on each licensed pharmacist and technician that works in each pharmacy. Okay? And we also added to that database for each pharmacy information on the number of prescriptions that the pharmacy dispensed to beneficiaries of the ODB. ODB is the public drug plan in Ontario. It's the major government drug plan. It covers your seniors, your social assistants, welfare recipients, people living in long-term care facilities. I say it covers roughly about half the total cost of prescription drugs in the province. And also we had information on the number of meds checks that the pharmacy performed over the course of the fiscal year 2015-16. And then Jimmy and some other people also manually transcribed for each pharmacy its sort of ownership status. There's a different variety of pharmacy in the province. You have your Costco pharmacies, you got your Walmart pharmacies, you got your chain pharmacies like Shoppers Drug Mart, you got your complete independent pharmacies, you got your banner pharmacies. Banner pharmacies are pharmacies that operate with a common look and feel, but they're independently owned. Excuse me. So we sort of categorize all those pharmacies, and then, yeah, like I said, we, like Jimmy said, we just identified these questions, tried to address these questions. Now, some of the pharmacies did not get matched. Like we had some pharmacies for which that were in the OCP database, but were not in the ODB database. There was no claims records for them, no prescription records, and some in the ODB, but not in the OCP. I guess this reflects the fact that the timing of these two different databases are slightly off. Like we don't have, the OCP data was a snapshot in September of 2016. And the ODB was data that reflected activity over the fiscal year 2015-16, so it was a 6-month gap. All right. So let's look at the characteristics of the technicians employed in community pharmacy in Ontario. Well, there's over 4,000 people employed. It's a pretty feminized industry, I'd say. Lots of women.
Should be.
Should be. Are you saying that men can't count? Yeah, you don't want men to do this job. I've seen them work. It's a bone show. Most of the technicians, they work in just one pharmacy, but 11% work in two. And you have a bunch of keeners. They work in up to 13. They're registered in 13 different pharmacies. I guess they're very mobile people. I'm not sure exactly what that person's doing, but yes. Now, like Jimmy said, the technician has only been formally regulated for the last 8 years. Time of our snapshot, which is 2 years ago, roughly, we looked at the average number of years that the people have been practicing, have been licensed rather, and it turns out that the average was 2.6 years. This is a relatively, at the time of my analysis, our analysis, is a relatively young profession. The people necessarily weren't young, but as they were only recently, in many cases, licensed as a technician. Okay, so where do they work in community pharmacy? Well, roughly 1/4 of pharmacies, community pharmacies in Ontario, employ technicians. This graph over here reflects the histogram of the ratio of technicians to pharmacists in a community pharmacy. Okay. So what this tells us is that most of the pharmacies employ more pharmacists than they do technicians. It's roughly, the modal value was 0.5 or so. So that means for every 2 pharmacists employed in the pharmacy, there's 1 technician. That's the most common ratio of technicians to pharmacists. You do, however, have a little blip over here where you have 1-to-1, 1 technician per pharmacist, and you got these outlier pharmacies where you have, in fact, up to 3 technicians per pharmacist. So who is using technicians? So again, we sort of grouped the pharmacies in our data set by their franchise name or their function. The first item in this list is the central fill. This is not a standard community pharmacy. This is a pharmacy that will, I think what they'll do is they'll process prescriptions for dispensing and off-site. Let's say a long-term care facility, say. These kind of pharmacies tend to use, like all of them in our data set, 100% used technicians. And this is the fraction for which there was more technicians than pharmacists. So none of those pharmacies had more technicians than they did pharmacists working. Okay. Costco. It's the chain warehouse. You've all come across it before. Home of the $1.50 burger and drink combination. Yeah. Actually, it may have gone to $1.95.
Still $1.50 in Canada.
$1.50, yeah, and that includes a free refill. And there is one in St. Catharines. Yeah, so 97% of the Costco's in the province use technicians. And in 7% of those Costco's, they have actually more technicians than they do pharmacists working. And then, if you look at the outpatient hospital pharmacies, 73% use technicians, and roughly a quarter have more technicians working than licensed pharmacists. Okay. There's other, going down the list, there's other types of pharmacies. There's a major chain of pharmacies in Canada called Shoppers Drug Mart. Have you heard of this operation?
Yep.
You've heard of
That's
Shoppers?
where I started in New Jersey.
There's a Shoppers in New Jersey?
There was in the 70s when I started.
Wow.
Yeah.
They're owned by Loblaws now, which is a major food retailer. We do, yeah. Yeah. In fact, we're going to stop there on the way home and grab some dinner. Unless there's dinner. Is there dinner included in this?
That's so well. Loblaws.
We're going to Loblaws, is it?
Yeah.
Okay. All right. Actually, we're in Buffalo. Isn't Buffalo known for its wings?
Yep, just down the street, Anchor.
Is the Anchor Bar that close?
You can go on to it.
You guys want to go right now? No, forget it. Forget that. No. This is not. We're playing. Okay. Yeah. So Shoppers Drug Mart, about 1/3 of them use technicians. Rexall, Guardian are banner operations. Is this? And then I'd like to bring your attention to the independents. The independent pharmacies, 13% of the independents. These are standalone pharmacies like, the Buckhorn Pharmacy in Buckhorn, Ontario. Buckhorn is a very small little hamlet in the Cottage district. There's no other pharmacy within about 25 miles. This is a standalone pharmacy, has no banner. Those kind of pharmacies, 13% higher tax. This is the most common of the pharmacies in the biggest, by the way. There's more independents than Walmart's, for instance. Okay, so let's go ahead and look at another slice of data. In this case, what we did is we examined how the use of text varies with the volume of prescriptions dispensed. Volume of prescriptions to ODB beneficiaries. ODB, of course, is the Ontario Drug Benefit Plan. You've all heard of this thing. It's a single biggest drug plan in Canada. It's got a budget in the order of $4 billion. Those are Canadian dollars. So let's say $3 billion US dollars. Okay, so that we did is we categorized the pharmacies in our data set into 5 groups on the basis of the volume of ODB prescriptions they dispense. For each group, we looked at the fraction of those pharmacies that employ technicians. And yeah, the bottom 20%, the lowest 20% in terms of script volume, 7% of those pharmacies are employing technicians. You get to the top 20%, 46% are. So as you see the scope, as the size, as the scale of the pharmacy increases in Ontario, you see pharmacies more likely to be using technicians to help manage the workflow. And they also, in those cases, the bigger pharmacies also tend to be more industrialized in the sense they have more technicians than pharmacists working. Okay, now the more contentious aspect of the research. As Jimmy told you earlier, the entire reason for having technicians in the province was to free up time for the pharmacists to provide these, what is called expanded scope activities, meds checks, patient counseling activities. And we wanted to test this. Now, we didn't actually have a formal randomized control trial. We didn't have that luxury. I think the data suggests that the answer to the question is no, that having technicians by themselves was not going to make a big impact on the pharmacy's provision of these meds checks, these counseling services. What we did is we used a statistical technique, a regression model, to estimate the impact of the employment of technicians on both the probability that over the course of the year the pharmacy will provide at least one meds check, and secondly, conditional having provided at least one meds check, the number of meds checks they provided, sort of the volume. This is so the first thing is the likelihood of providing meds check, the second is the volume of meds checks, given that you are in the business of providing meds checks. The data were gleaned, we focused on the community pharmacies with storefronts that are treating ambulatory patients. We removed the central fills. We also took out the hospital pharmacies. These are more standalone, conventional pharmacies. So in terms of the probability of providing this one meds check, not really any effect. Having a technician on staff doesn't make much difference to the likelihood of providing a meds check annual. I'm talking now about the meds check annual, sorry, I should have clarified that. That's the most common of the meds checks. There are other meds checks we'll talk about in a second. Right, so There's very little impact of having a technician on the probability of providing a meds check. However, there was a slight increase in the volume of meds checks provided by pharmacies that had technicians employed, up to 1 FTE. If you had like the 1 FTE of a technician, you're actually providing more meds checks than comparable pharmacies without any technicians. So there was a modest effect, not a huge effect. The pharmacies that had lots of technicians, they were less likely to provide meds checks. This reflects, I think, a characterization of the kind of pharmacies that hire technicians. It's not the fact that the technician will make them stop providing meds checks. It's the fact that a pharmacy that is involved in dispensing a lot of drugs are the ones that tend to hire technicians. So I think now the Costco pharmacies. Costco pharmacy in Ontario has the draw that the dispensing fee is only $4, which is quite low relative to the average of around $10 or $11. So they're filling a lot of prescriptions. They aren't providing a lot of meds checks. So they're the ones hiring the technicians to fill those prescriptions. It's not that the technicians themselves are causing them to fill most meds checks, simply because the nature of the pharmacy is such that they hire technicians and they provide less meds checks. Okay, so that's what we found for the annual meds checks. And then we found some mild effects actually on the impact of having a technician on the likelihood of providing a meds check for the other type, the follow-up meds check, diabetes, following the hospital. There's a slight increase in the probability of providing a meds check if you have a technician relative to if you don't have a technician employed. Again, pharmacies that hire lots of technicians are less likely to provide these meds checks and tend to provide fewer of them. So overall, then, the evidence suggests that the presence of technicians in Ontario is not really facilitating a lot of meds checks. It's not like they're, as the Ontario College of Pharmacists had hoped, freeing up time of pharmacists for them to be able to provide a lot of cognitive services to patients. They appear to be there to help facilitate the traditional dispensing workflow. So, wrapping up, or just reviewing what we learned, roughly a quarter of the pharmacies in Ontario back in September of 2016 were employing technicians. Pharmacies that process large volume of prescriptions were more likely to hire technicians. Independent pharmacies were among those that technically didn't tend to use technicians. It was more the Costco's, the Shoppers Drug Marts, the ones I think with a bit more of a top-down management, like a central management, where the pharmacy there's a chain of pharmacies perhaps, and there's a central body which administers the HR across these pharmacies. Independent pharmacies don't tend to use technicians. So there was a slight increase in the probability of providing a meds check if you have a technician. This was for certain types of meds checks, diabetes, the meds check at home, the meds check long-term care, but it was a very small effect. And pharmacies employing 3 or more technicians were less likely to provide meds checks. But again, that reflects this feature I talked about. It's the pharmacy, it's a pharmacy effect, not a technician effect, causing there to be fewer meds checks performed. So this is an observational study. We didn't do a randomized control trial where we helicopter dropped some pharmacies with technicians and some did not. We sort of of the data as it came out in the real world. So these are not causal effects, like I said earlier. We couldn't control for non-licensed personnel, like pharmacy assistants. We didn't look at the provision of other types of cognitive services, like smoking cessation, injections, immunizations, etc. And like I said earlier, there was this delay of 6 months between this receipt of the OCP and the receipt of the ODB data. That concludes the formal part of our presentation. Happy to take questions or discuss. Yes?
Your presentation sounds very similar to the situation we have in California with Tech Check Tech, in which there are some requirements that the pharmacy leaders have to do. And many of them don't want to bother with it, don't want to try something new, aren't sure enough of their technicians to be willing to say, yes, we can train you to do what you can do.
There's maybe some hesitancy to change the operating procedures of pharmacy, in other words, yes. Well, it makes some sense. If you look at our results from the MedCheck annual, the most commonly provided MedCheck, again, having a technician doesn't affect the likelihood of providing MedCheck, but if you are already providing MedChecks, it may have a small effect on the volume that you do.
Yeah, just to add to what Paul was saying, I would completely agree in terms of it was a very big change for not only technicians, but for current pharmacists as well, in terms of they were kind of getting used to adapting their own new scope of practice, especially for pharmacists who've been working 10, 15, 20 years on just, dispensing and counseling prescriptions. Now all of a sudden they're giving flu shots to patients. Like, this is new to them. And in addition to that, you throw in, you know what, instead of you being responsible for the technical check of the prescription, let the pharmacy technicians do it. And this is something that's totally 100% new for pharmacists in Canada. And that's a role challenge in itself in terms of there needs to be that trust and that communication between the pharmacist and the technician. So I think it's a perfectly similar situation that you do describe. And I think it's still a challenge today that pharmacies in Canada, in Ontario particularly, are dealing with. And I think that's probably not the main reason, but it's one of the reasons why that only 25% of pharmacies in Canada are even using technicians in the first place. Most pharmacies are still going with the model of let's hire one pharmacist, a bunch of pharmacy assistants or clerks, and that's enough. And they're kind of going the fact that we don't need a pharmacy technician. So it's a lot about, I think the difficulty and the biggest maybe mistake, or perhaps Ontario could redo this again, is the rollout of that pharmacy technician role. It was kind of left up to the pharmacy owners to decide how are we going to implement pharmacy technicians into practice, and because of that, each owner kind of took their own way, and maybe they kind of thought of it from a business perspective, how can I integrate this pharmacy technician to my practice? And because of that business mindset, the clinical considerations in terms of the pharmacist doing expanded scope activities was kind of lost there. In addition to that role change, that role challenge, I think the rollout could have been much better as a result. And I think because of that, Canada can learn a lot of lessons on how the United States kind of implemented pharmacy technicians in their aspect. But I think my general understanding of the U.S. situation is that pharmacy technicians are, I think, would you agree, it's not 25%, but it's nearly 100% of all community pharmacies using technicians. And so that's a huge difference that we have there. And so to myself hearing that for the first time, I was like, oh my God, why is it so different between these two countries? And I think it's a very important point to consider.
A couple of questions. First of all, Paul, I love how you used your hand to point on there, because most of us have been using the pointer. But your height, you just got your hand on there.
Yeah.
You didn't need the laser pointer. I like that.
Thank you.
Compliment.
Thank you.
So I heard a couple of things, I think, when Paul was talking, and just curious. So what I'm familiar with is that in the States, when a technician registers or license, they license with the state. But what I'm hearing is that in Canada, they license and indicate what pharmacy they work at.
Yeah.
So they're licensed with that specific pharmacy?
No, they have to register the they have to notify the OCP where they're working, but they're not, they can change if they want.
Okay, okay.
Yeah, so-
That's something we don't track, so that's.
Yeah, exactly. So upon graduation and licensure of a pharmacy technician, they will register with a provincial college. There's 10 provinces in Canada. Ontario is one of them. They'll register with the Ontario College of Pharmacists that I am a certified pharmacy technician. Then it's required for them to list all their different work sites. And so that's where Paul described earlier, you know, that one instance where one pharmacy technician reported working at 13 different pharmacies in Ontario. So it is required to report, but of that requirement, it's a bit hard to say whether or not that's completely accurate. So.
One other quick question, sorry. So you gave some demographics of pharmacy technicians in pharmacies, relational to pharmacists, right? Was that before pharmacy technicians were given that title and giving more duties to help the pharmacists expand their role? Do you have like before and after data when that,
No.
okay.
This is all a snapshot as of 2 years ago roughly, at which time the pharmacy technicians were licensed, as they were regulated as a
So
profession.
you don't know if it increased? I mean, we would hope it increased at least a little when technicians were given that additional.
That's a good question, and we could in principle look at that. No, you can't do that, because we don't have we don't know, from the OCP at least, which non-licensed people were working at the pharmacy. It's all only licensed people, so we wouldn't know that.
Thank you.
Okay.
Just curious, you concentrated on community pharmacies. Do you have any idea if hospital pharmacies are more open to the ideas of hiring registered technicians?
I wish I could speak from more of a maybe like scientific background, but in terms of my anecdotal experience working in hospitals firsthand, pharmacy technicians have a huge role to play in Canadian hospitals, and I think one of the previous speakers, Lisa, kind of spoke to the kind of the role that technicians can play. A lot of tasks that were previously performed by pharmacists are now performed by pharmacy technicians. Probably the biggest difference that I can say is basically across every hospital pharmacy in Canada. Maybe if I were to go back 15, 20 years ago, the dispensary where the medications are prepared and filled for in the hospital setting, that was done completely by pharmacists. These days, it's rare to go into the hospital dispensary and find a pharmacist there. Pharmacists have also taken expanded scope in the hospital setting as well. And that's more in terms of having a presence on the hospital medical team. So for example, if rounds are happening, the doctors talking with the different allied healthcare professionals such as nurses, pharmacists are there too, giving that background and confirmed a drug perspective, identifying potential drug therapy problems. And because they're there instead, pharmacy technicians have stepped up, and this has been facilitated with their own regulation, now they can do a lot more of the practices that are done in the dispensaries traditionally. But unfortunately, I'm speaking mostly from anecdotal experience, but I think it's common what we find as well.
I'm from Washington State, the other side of the country, and I've witnessed two situations where they call it adherence counseling, like med checks, and it's tied to money. So if it's a clinic that has Medicaid, they follow the patient, and there's certain things like the diabetes they'll track, and the heart patients they'll track more. And then AIDS Health Foundation gets their money from foundation, and they're worldwide, so I guess that's a way, and the drugs are way more expensive than the antivirals. So the counseling and the connection to the pharmacist contacting the patients is higher.
Oh, right, there's more of a
It's
contractual relationship between
Yeah.
the drug
They track
plan and the Medicaid plan and the pharmacy, yes. This is kind of the same thing. The Ontario government pays the pharmacies that provide these services. I think it's $50.
$75.
$75 per visit, or per encounter. There was a concern about the quality of this consultation. I think there were some accusations of drive-by or drive-through meth checks. They size you up and say, Yeah, you sure you understand how you take this medication? Great. There's your meds check.
Yeah.
Government's tightened up the most bits.
Yeah, if I could just quickly add to what Paul said, it's exactly like that. Meds checks have been under much scrutiny. There's a lot of research out there in the Canadian landscape on the utility of meds checks and how people have been using it. As I said earlier, you get $75 for doing it. And you know, if you're doing these drive-by meds checks, which pharmacists are, and I've seen it firsthand, it's a lot more than you think. You know, if you can spend 2 minutes to do a quick meds check on someone and get $75 for it, imagine if you keep doing it. Because of that, there's been lots of changes and regulations to meds checks, and as well, you know, that kind of has impacts in terms of limitations of our research as well. Meds checks are one way of measuring pharmacy clinical services, but you know, if Paul and I could, you know, perhaps advance our research or next steps on what can be done further, it's looking at other different types of clinical services that pharmacists can provide. Because within meds checks itself, there are challenges as accurate measure of clinical services.
I have, sorry, go ahead.
Go ahead.
This is actually off topic, so I'll let you ask your.
Okay, I'm a little bit confused. So you're adding more technicians so that the pharmacists have more time to do the meds checks, you call them.
That was the rationale for having technicians in the
So
first
in
place.
your opinion, why did that not work? Because if you have more of us to do the bulk of the work, that should free up your time to.
Well, you can, if you're an owner, suppose that you're this may not happen in the States, but it does happen in Canada, you have a for-profit pharmacy.
Yeah.
You know, technicians are less money than a pharmacist,
Assistants.
a full-on pharmacist.
Way.
So, yeah, so what, hire fewer, substitute more technicians?
But are you not defeating the purpose of being able to be available to your customers?
Yeah, why did the meds checks go down?
Well, there could be some small effect. But it seems to be, from our data, that they're having more prescription volume.
Yeah, if I could comment, it's that I think pharmacies in Ontario aren't utilizing technicians, unfortunately, to their fullest potential. And recently, in the same month that Paul and I published our work, there's another very interesting paper published in the Canadian Pharmacists Journal as well, speaking about the integration of pharmacy technicians into Ontario community pharmacies, and they did a lot of qualitative research. They did surveys with pharmacy technicians, and unfortunately, overall, there's some unhappiness on how pharmacy technicians have been being used in these pharmacies. They feel like they're more glorified pharmacy clerks or pharmacy assistants rather than a pharmacy technician itself. And I think that's what Paul's kind of saying. You know, the pharmacy owner thinks, how can I best make money using pharmacy technicians? And it's not because they're using the pharmacy technician to help do more clinical service, it's to push out more prescriptions. If I can get my technician to simply do the final technical check of the prescription, that makes me be able to pump out more pharmacy prescriptions. And I'd rather focus on that than focus on advancing, you know, making my pharmacists do more meds checks or other clinical services.
So then my biggest question is, where is your patient safety?
Well, technicians are
You're talking
presumably.
about pumping more money.
Well, we're not. I don't think people are at risk. I think that the prescriptions are being reviewed, perhaps by a technician, perhaps by a pharmacist. But they're. If I go to the pharmacy for my refill script, it's you know, here you go. Like they don't really. A lot of the time, you don't even see anybody. You just sort of get your prescription, and then they say, "Yeah, on your way."
On this side of the border now.
Did you have a question for something?
I have a question about. Let's take it. I have a question about a different topic. I wanted to address the audience.
Well, I had just one on your topic. You mentioned that there were 9 of the 10 Providence. Which Providence doesn't have the text regulated?
Quebec doesn't have it.
Huh?
Quebec. The province of Quebec is not technically a technician.
Gotcha. Thank you.
No problem. Very
To be
good.
quick, is it even an expectation? I mean, that may sound like a simple question, a meds check. If it doesn't become an expectation of the job function, then it doesn't happen.
Well, people are not, you know, the clients, the patients, the beneficiaries of the ODB, and even other people who are eligible, they don't, it's not like they're aware necessarily of the service. I mean, they probably don't know, they don't understand the importance of having your medication reviewed if you take 5 medications. That's why I think it's a huge marketing opportunity in pharmacy, is to get aging wealthy boomers to pay for concierge pharmacy counseling. That's my view of how this should evolve. But so I was wondering, if I could I just quickly ask a question? Because I'm doing some research and I've had a very hard time getting this information. I'm doing a bit of work on the effect of PBMs. Are you familiar with these pharmacy benefit managers?
Yes. Yes.
Right, PBMs. So if you look at the number of pharmacies in Ontario, in Canada, it's roughly 30 per 100,000. If you look at the numbers in the States, it's roughly 20 per 100,000. So there's 50% more pharmacies in Ontario or Canada than there are in the States. Why is that? Well, I think my guess is that PBMs have squeezed the margins a bit from the retail pharmacy. It's pretty tough. It's not you're not making a lot of money being a pharmacist. Being a pharmacist. That's my theory. I could be wrong on this. Okay, well, it's not the reason. Okay, well, let me get to the point then. I'm trying to find data, very simple request. Every year, I need in the States how many pharmacies we're operating, community pharmacies. Think I can find this information? It's like nobody collects this data.
You know what, if you want to email me what you want, I'll put it out to about 25 minutes.
Oh, okay.
And answer for you.
Thank you so much.
Thank you to our friends across the board.